Welcome, dear listeners, to another episode of Free Me from OCD. I'm your host, Dr. Vicki Rackner, and today we have an important episode lined up for you. We'll be delving into the complex world of trauma and explore its relationship with OCD. Welcome to the Free Me from OCD podcast. If you or someone you love has OCD, you know that OCD can hold you hostage. OCD can get in the driver's seat of your life. Here you'll find the information, tips, and tools to put you back in the driver's seat of your life. I'm Dr. Vicki Rackner, your host. I call on my experience as a mother of a son diagnosed with OCD when he was in college, physician, and life coach to help you evolve into the best and highest version of yourself. Let's dive into today's episode. Let's kick off the conversation about trauma with a story. Just a few months before Hurricane Katrina struck, my house burned down. A switch that kept the dryer from overheating failed, and the fire that started in the laundry room quickly spread. I stood across the street and watched flames consume my home and its contents. My 8-year-old son wasn't in the house at the time. The next morning, we went to the property and looked through the windows. Then we visited our cat being treated at the veterinary hospital. The firefighters had found her in the closet, brought her out, and administered oxygen. Even with the best veterinary care, she died 3 days after the fire. My son and I buried her in the backyard. As the weeks went by, my son started having nightmares. He feared that a bus would crash onto the second-story balcony. He was convinced that our cat was alive and trapped in the box from the newly purchased computer printer. It's like his brain was scrambled. My parenting coach recommended a therapist who specializes in childhood trauma. After an evaluation, Kathy, the therapist, diagnosed my son with PTSD. She recommended her trauma protocol that includes and builds on a treatment called EMDR, eye movement desensitization and reprocessing. To explain it, she asked, "Have you ever gone to bed with a problem that seemed to be solved when you woke up?" She continued, "When we treat people with trauma, the problem we solve for is how to let the brain know that the dangerous past is over and that the present moment is safe. The challenge is that we have to communicate to the brain in a way it understands, and trauma limits the brain's ability to understand words. You can tell a soldier with PTSD, 'Hey, you're not in Afghanistan. Look around. You're safe in the USA.' But that doesn't help." She said there's evidence that the back and forth eye movement seen in REM sleep activates some internal self-healing response, sort of like turning on a self-cleaning oven. We think that the results we see with EMDR are a result of signals crossing between the left and right hemispheres of the brain. Kathy told me she added another layer to EMDR. To prove to the brain that the past was over, she would ask my son to see a series of pictures in his mind that captured the days and the weeks that followed the fire. Then she would take him through a timeline. She explained it's easier for kids to see these images when their eyes are shut. So instead of using eye movement, she would get signals to cross between the left and the right hemispheres of the brain by alternatively tapping my son's right and left knees. In addition, she would ask him to wear headphones that alternatively delivered sounds to the right and left ears. She shared with me the extraordinary results she had gotten with other children. Kathy asked if I had any questions about the proposed treatment. I wanted to ask, well, are you also going to slip ruby slippers on his feet, ask him to tap his heels 3 times, and think, there's no place like home, there's no place like home? This treatment sounded crazy to me. I never heard of eye movement therapy when I was in medical school. I told her I didn't have any questions. She asked, would I consent to the treatment? Well, quite honestly, I doubted it would help, but I consented because I didn't think it would do any harm. I was present during my son's treatment sessions. Kathy told my son, here's your job and it's really easy. I'm going to ask you to imagine you had a camera in your head that took pictures of something special from each day. If I asked you to share a picture from yesterday, what would it be? He said, going to the Mariners game with my mom. Kathy said, great. She said that the only question she would ask him was whether or not he could see the picture. Other than saying yes or no, he didn't have to say anything. Then she explained that she'd also ask him to wear the headphones and ask for permission to tap his knees. Then they got started. She asked my son to picture the day of the fire. Did he see the picture? Then the next day and the next day and the next day. At the end of the second session, after going through these timelines multiple times, she asked my son to tell her about the cat. He said, my cat died in the fire. I'm sad she died. I loved her and I miss her. Kathy asked if the cat was in the printer box, and he said, no, her body's in the dirt. Had I not seen this with my own eyes, I would not have believed it. It's like a switch went on and his brain was unscrambled. Let's talk about trauma. The word trauma means different things to different people. In this conversation, we're going to use the medical definition of trauma as stated by physician and trauma expert Dr. Gabor Mate. He says, trauma is not what happens to you. Trauma is what happens inside of you as a result of what happened to you. The word trauma comes from the Greek word meaning wound. For a person diagnosed with trauma, the traumatic episode changes their nervous system in a specific way that leads them to feel unsafe in the present moment, even when the traumatic event is in the past. A person has trauma the same way a person has OCD. Well, what happens in the brains of people with trauma? We can understand this through the lens of evolution. During the Paleolithic era, we were both predator and prey. The brain is obsessed with a single question. In this moment, am I safe or am I in danger? The nervous system that includes the brain and the spinal cord and the nerves that carry information to and from the spinal cord is like a finely tuned orchestra. The autonomic nervous system is its conductor. It automatically responds to meet the physiologic needs of the moment. It automatically speeds up your heart when you exercise and then slows it down when you rest. If you're a diabetic, you know how profoundly your life changes when you consciously take over glucose management. And that's just one of the thousands of jobs your nervous system automatically manages. The highest and most important job of the orchestra of your nervous system is detecting danger and getting you back to safety by fighting, fleeing, or freezing. So imagine that there's always music playing in the background of your life, and the conductor, your autonomic nervous system, decides which of the three symphonies the orchestra plays in any given moment. The symphony is chosen on the basis of whether or not you feel safe and the nature of the threat. The first song is the song of safety. The autonomic nervous system plays it when it creates the physiologic state you enjoy when you feel safe. Let's call this the green zone. Consider this your home. You are the best version of yourself when you're in the green zone of safety. If there's a saber-toothed tiger nearby, the autonomic nervous system tells the orchestra to play the song of flight. Maybe it's even a version of the flight of the bumblebee. The entire nervous system creates the physiologic state to help you fight or flee. Your heart beats faster. Your blood gets diverted from your digestive tract to your muscles. Your vision narrows. When you hear the song of flight, your autonomic nervous system creates a physiologic state we'll call the yellow zone. After your escape, the autonomic nervous system changes the music back to the song of safety. You shift your physiologic state from the yellow zone of danger to the green zone of safety. Sometimes when you're in danger, you can't fight or flee. The saber-toothed tiger has you cornered. When the autonomic nervous system thinks that death is near, it activates the freeze response. Maybe the orchestra is playing the score for the movie Jaws. Dun, 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 dun. This creates your third physiologic state that helps you feign death and dissociate from your body, presumably to make death less painful. Let's call this the red zone. Once you're back to safety, the autonomic nervous system shifts you from the red zone to the green zone. Here's the most important part. You experience the world differently in the green, yellow, and red zones. I once toured a botanical garden with a friend. On the ride home, we reflected on what we liked the most. The things above my friend's head, the trees, caught his attention. The things below my head, the perennials and shrubs, caught my attention. It was as if we toured two different gardens. So too, in the different physiologic zones, you see different things. You hear different things. You respond to people differently and think different thoughts. When you feel safe, you see safety. When you feel threatened, you see threats. If the physiologic zone of safety and danger is so important, you should consciously decide, right? Well, that is not how it works. Your autonomic nervous system, not your conscious thoughts, automatically determines if you're in the green, yellow, or red zone. This is outside of your control. However, you can learn skills to recognize what zone you're in and master skills to shift back to the green zone of safety. Trauma is the condition in which you get stuck in the red zone. You cannot shift back to your zone of safety, the green zone. It's like Groundhog Day, only it's a day you wish you never had. To make things worse, trauma changes your nervous system in a way that makes it hard to forget. You might be wondering, well, why would we be vulnerable to this kind of wound? The lens of evolution might offer an explanation. Imagine our paleo ancestors foraging on the savannah. A tribe comes across a bush with a new berry. They don't know it, but the berries are poisonous. Some of the tribe members witness the deaths of the people who ate the berries. Doesn't it make sense that the nervous system would bookmark this event? When you see the berry, your body brings you back to that awful moment to remind you not to eat the poisonous berries. There's evidence that trauma changes gene expression. This means that trauma can be communicated through the generations. A parent who never saw the berry can have a child who knows the berry is poisonous. Maybe trauma was designed to keep the tribe, not just individuals, safe. Well, we can only speculate about whether or not trauma was adaptive in the Paleolithic era. We know with certainty that trauma is maladaptive in our world. Trauma leads to tremendous disability. How common is trauma? Well, the best data we have suggests that about 6% of Americans have trauma, as compared to 4% with OCD. Undoubtedly, the numbers are much, much higher. You might not be surprised to learn that people with OCD, like my son, have trauma in their past, just like my son. We can only guess at the number of people experiencing intergenerational trauma today. We can only guess about the long-term impacts of social media on the incidence of trauma. Algorithms feed you a steady stream of content to take you out of the zone of safety and into the zone of danger. Why? Our brains preferentially pay attention to threats. It keeps users on the platform longer. We can only guess how many people will be diagnosed with trauma as a direct result of living through the COVID pandemic. The pandemic had its most profound impact on children. Trauma changes the brain, and a child's developing brain is most vulnerable. Everyone lives through traumatic episodes. How do you know who has trauma? Well, let's get back to my house fire. I remember the final session of my son's treatment. His therapist, Kathy, had asked him to draw a picture of the cat. While he was drawing, Kathy asked me how I was doing. I just laughed and told her, "Oh, Kathy, I'm too busy to think about myself. I've got too much to do." I did, however, confess that there were days I sat immobilized in a chair, overwhelmed by my task. I felt all alone. The challenge of rebuilding seemed too big, and I was too small to take it on. But I had to get through it, so I forced myself out of the chair and got going. Kathy said, "I'm just curious, did anything traumatic happen to you when you were a child?" And then it clicked. Yes, something did happen. Our family lost our house when I was 6, and we had to move. My parents didn't want to talk about it, so my brother and I were left on our own to make sense of what was happening and find comfort. Kathy said, "Wow, that's really interesting. You and your son were displaced from your homes at about the same age." She told me she had an idea about what was happening for me. If she was right, the same therapeutic process that helped my son could help make my life easier and more manageable. Would I like to set up an appointment for myself? Yes, 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 I told her. In our first session, Kathy took my history and then explained her hypothesis. She asked me to imagine that humans grow and develop like trees. If you look at the rings of the tree, you see that some rings are thicker in the years when the growing conditions were good, and thinner rings during stressful years. Sometimes you see a scar in an isolated ring. This happens when the tree sustains a non-lethal injury, say by fire. So too, humans grow and develop, and we do our best when we feel safe. There are stressful years, but growth continues. Sometimes, though, dramatic and traumatic things happened. Kathy asked me to imagine my saying to my 8-year-old son, "Well, sweetie, I've got things to do, so I'm leaving. I'll stop in now and then to make meals and do the laundry. But while I'm gone, I want you to rebuild our house and our lives." That was your childhood experience. You had some big, powerful feelings, and there wasn't an adult there to comfort you or guide you. Your wound was caused by trying to manage an adult-sized problem on your own with your child-sized tools. It doesn't work. That's your scar. If your parents had told their 6-year-old daughter what was happening with the house instead of keeping secrets, answered your questions instead of avoiding them, and helped you process your feelings, you could have healed at that time. The ring from your 6th year might look normal. Hopefully your son's 8th year ring will be normal after this intervention that we did. So right now I had a scar in my 6th year ring. She was clear that she was not blaming my parents. She said that they were parenting me in the way that they were parent. This may well be an example about how trauma gets transmitted through the generations. She said, "Today you're living in your outer ring with access to the wisdom and skills you've collected your whole life. Of course your house fire would bring you back to the 6-year-old version of yourself. The person who's trying to manage the fire has the tools that a 6-year-old has." She suggested it's the 6-year-old version of yourself sitting immobilized and overwhelmed in that chair. Of course the job is too big for a 6-year-old. Of course she feels poorly equipped to get the job done. Of course she feels alone because she was alone when she was 6. All of this made perfect sense to me. My nervous system is constantly eavesdropping on my thoughts. The thoughts, "I can't do this, I'm alone," or "this is too big for me and I can't find help." I had those thoughts all the time, and those thoughts caused me to trip into my trauma. Then the autonomic nervous system does what it does so well. It said, "Whoa, this reminds me of a time in the 6th year. Remember when she lost her house? We're going into the red zone." The Jaws music played. I froze. Suddenly, I was 6 years old again. With her hybrid EMDR treatment, Kathy suggested that we could remind our brain, "Hey, I'm not 6 years old anymore, and I'm an adult with car keys and credit cards. I know how to feel my feelings. I can reach out for help." If I thought that, that would bring my adult self to the monumental task of recovering from the fire. I got this. I agreed to become Kathy's patient for my own trauma work. We worked through the timelines just as she did with my son. At the end of the first time through the timeline, she said to this 6-year-old version of me, "Vicki, you've been working hard after the fire, and we appreciate all your efforts. There's a reason it's been so hard for you, and that's that this is an adult problem. The good news is I've got a plan to help you get back to your important job of being a kid. You can hand off all of the house fire jobs to the adult Vicki. Think of her as your new mom. She'll also take care of you and keep you safe as she rebuilds your house." We went through the timelines in many sessions, and as we did so, I found that I spent more of my time as my adult self and less time as my 6-year-old version of myself. So my unrecognized trauma was making a hard situation harder, and I didn't even know it. Well, not everyone with trauma can say the same thing. After several tours in Afghanistan, John suffered from PTSD. His wife describes John as a great guy, now with dark secrets. John would have moments when he just wasn't there. Even when he was there physically, he recoiled when strangers approached him. When they went anywhere, the first thing John did was look for all the exits. He seated himself in a room so that his back was never towards the door. He had nightmares. He sleepwalked. John had been through PTSD treatment at the VA. His wife said that the one thing that made the biggest impact on John was the time he found out that someone in his support group died from a heroin overdose. In the addiction community, substance abuse is thought to be a maladaptive effort to manage trauma. Then John got a service dog, and it transformed his life. His dog seemed to know what to do to restore John's sense of safety. John's nightmares and sleepwalking eased off. Here are some common indicators that suggest the presence of the kind of major trauma that leads to disability. There's vivid and distressing memories of the traumatic events that sometimes arise unexpectedly. Maybe there's recurrent nightmares. Maybe someone with trauma avoids places or people or activities that remind them of the traumatic event. Some people say they feel numb. Others are startled by loud noises or sudden movements. Some detach from relationships. Sometimes the effect of trauma may not surface until months or even years after the event. Additionally, everyone experiences trauma in a different way. Well, here's the real reason I'm recording this episode about trauma for a community of people managing OCD. Trauma and OCD are connected. One study finds that about half of patients diagnosed with OCD lived through a traumatic episode. Up to 30% of people being treated for PTSD have been diagnosed with OCD. In fact, the VA sees enough cases in which patients develop OCD after PTSD, they've described a new entity they call trauma-related OCD. Both OCD and trauma deal with the question about how and where you draw the line between safety and danger, and the challenges of moving from the zones of danger back to the zone of safety. Trauma and OCD are like cousins. So here's more about what we know about people diagnosed with both OCD and trauma. First, trauma can intensify OCD symptoms. This is particularly evident in cases where the trauma is related to the obsessions or compulsions themselves. For example, a person with contamination themes who witness a COVID-related death may find their symptoms more severe. Trauma can influence OCD themes. A person who's experienced a traumatic event related to harm or violence may develop obsessions about harm or compulsions aimed at preventing it. OCD can serve as a coping mechanism for people managing trauma. Engaging in repetitive rituals may offer temporary relief from the distressing emotions associated with trauma. Well, let's say you're diagnosed with both trauma and OCD. What do you do? Well, it's important to approach treatment in a thoughtful and integrated manner. It begins with a thorough assessment by a healthcare professional experienced in diagnosing both OCD and trauma. The healthcare team will most likely address immediate safety. Now, trauma makes you feel unsafe, but if you actually are unsafe, you need to get to a safe environment. You want to educate yourself about both OCD and trauma. You want to build a treatment team. You may get trauma treatment from one therapist and OCD treatment from another. Ideally, your team members talk to each other. Then they make a plan for sequencing treatment. Generally, treatment begins with trauma-focused therapy. Once you've made progress in processing and coping with trauma, the focus gets shifted to managing OCD. And remember, exposure and response prevention, or ERP, is the gold standard treatment for OCD. Most people, and if they're not, they should be, are reminded to embrace habits that promote optimal brain function. Get regular sleep, eat healthfully, exercise, and don't forget the other vitamin C, connection. We are most likely to shift from the zone of danger to the zone of safety when we're with people who already feel safe. As we wrap up, here are the most important trauma takeaways. Trauma is not what happens to you. Trauma is what happens inside of you as a result of what happened to you. Trauma is not a psychiatric or psychologic disorder. It's a physiologic disorder. Trauma is like a jammed clutch of the autonomic nervous system, making it difficult to shift from the zones of danger back to the zones of safety. And today, individuals with OCD and trauma suffer. They might not even have a formal diagnosis. They might have not found the right healthcare professional or the treatment that works for them yet. I'm optimistic that the future holds the promise of effective treatments for both OCD and trauma. Maybe it's not about what the healthcare professional does to you or for you. Maybe it's something that they do with you. What if treatment is a collaboration that unleashes the self-healing powers of our nervous system? I wonder if our therapist, Kathy, did in fact serve as our own personal Glinda, offering my son and me the ruby slippers to get back to the home of safety. Maybe she reminded our brains to activate its magical healing we didn't even know we had. Well, what can we do today to alleviate the pain and the suffering of OCD and trauma? Anyone who wrestles with OCD or trauma knows the critical value of creating the feeling of safety within our families and in our communities. Safety is particularly important for people with neurodiverse brains. They live in a world they experience as unsafe. It's not safe to be different. It's not safe to tell others what you want and need. It's not safe to learn and communicate differently. Getting and staying safe is a team sport. You know this if you or a loved one wants to be freed from OCD. That's why I created the OCD Haven. It's a virtual community that offers a safe place to educate yourself about how your human brain works, especially with OCD. Share your stories and get coached. I'm about to reopen the OCD Haven. Please sign up below if you want to be on the waiting list to be the first to be notified when the doors open. You can join this community of amazing, like-minded people from all around the world, all committed to being in a safe place, to explore ways to have a good life. Well, thank you for investing your time listening to this podcast episode. I hope that you found value in this content, especially given the world we're living in today. With intergenerational trauma being in the news, please feel welcome to share this episode with friends and family. Let's get the word out about both OCD and trauma. Education can go a long way. You can be freed from OCD, and we'll show you how. Thank you again. Please sign up below to get on the waiting list for the OCD Haven.